We want to welcome everybody this afternoon to the benefit workshop. We have representatives from Anthem Blue Cross, Kathy Spear, presenters from MHN, Joy Belamo, VSP, we have Renee Salvador, and Peggy Nieto from Delta Dental. I'm going to pass the microphone to Rose Delgadio.
Thank you, Anne-Marie. Anne-Marie Estrada is our Burnham Benefits representative. I want to thank Anne-Marie for helping to put and organize these workshops, along with some of our staff, Joan Carr, our payroll manager, who has responsibility for benefits, Evelyn Reed, who is our benefits specialist, and the Health and Welfare Committee, who is your constituent group that comes together every month to discuss directions for health and welfare. So I'd like to thank them for all of their effort. We recognize that the benefit arena is changing, and I think you recognize that as well. There's no question that costs have been going up, that you've been asked to bear a little bit more of the burden on this. And we appreciate what you're doing in that regard, but in light of the changes that are happening, we thought it would be very worthwhile to bring together this workshop that would help you understand what your benefits look like, how to take advantage of them more effectively and efficiently, and then, of course, how to help you save money. Any little tricks we can all learn will be to all of our benefit. And so I appreciate you being here, and I appreciate everybody who's put this workshop together, and all of our sponsors, vendors who have come together to give you this information. So thank you to everybody, and I'm going to turn it over to our folks.
Thank you. Thanks, Rose. We have Kathy Spear from Anthem Blue Cross.
Well, it's nice to have you before lunch. It's good because I think you'll want to get out of here quickly and you'll listen very attentively, right? Wanted to start with just going over the two plans that you have available to you. Each of you have probably chosen one or the other of them, but there's always the point in time that you might think about changing to a different one. But I'm here just to kind of explain the two plans and go over the basic differences between the two. And so what we have is the HMO and the PPO plan. The HMO plan is directed by you signing up for a primary care physician under the umbrella of a medical group or an IPA. With that, your primary care physician is really pretty much the one that helps to facilitate getting you to a referral specialist, or if you needed to be hospital confined, making sure that that all takes place. So the key to the HMO plan really is your primary care physician. And if I were to recommend anything, it would be that you get to know that primary care physician and that you have complete confidence. If you don't, there's no need to stay with that same physician. You can change, and we'll talk about that in a little while. The way the HMO works is it's just a simple co-payment, except for a few exceptions. And the first one is going to be preventive care, which is now a part of your plan and is covered at 100%. We'll talk a little bit more about the preventive care piece in another section, but hopefully most of you picked up the preventive care. It was a two-pager. If you didn't, they'll be on the back. It gives you kind of an understanding of what is covered under preventive care and at what age, because there is definitely different coverage per age. So just so you have that available to you, I think it's really nice to know that you get this covered at 100% without any co-payment at all under the HMO. Otherwise, if you're using the HMO and you go to a regular primary care physician visit, you pay $20. If you're referred to a specialist, it's a $20 co-payment. Any lab work that's done, any outpatient surgeries, any hospitalizations is covered at 100%. So with that in mind, it really kind of gives you an idea of what the cost will be to you throughout the year. So if you have a family, you kind of know what it would cost because there's no unexpected parts that you're going to share in the cost of. The one piece that's been added, just that we'll talk about as well, is the emergency room benefit being an extra $100. So when you visit the emergency room and you don't end up in the hospital, then it's $100. If you do end up in the hospital, it's waived. So kind of wanted to point that out, and we'll talk again a little bit more about that in another one of the slides. Now, the PPO gives you complete flexibility in terms of who you go to. We do have a preferred provider network, PPO network, and it's one of the largest in the state of California. It includes doctors, hospitals, labs, all sorts of facilities. And with that, you get a better benefit. The way the benefit is set up is that the basic office visit, when you go to a primary care doctor, a regular doctor, or a doctor just for an office visit, is a $20 office visit copayment. You don't have to meet a deductible at all, but that $20 is not going to go towards the deductible either. So you get to go for that office visit as a $20 piece. If you're using a non-participating provider, there is not a copayment. So just to know that there is a difference between PPO and non-PPO. Now, other than the office visits, any other charges, let's say that you went in for a procedure at the dermatologist, that wouldn't be an office visit, that would be a regular procedure, and a visit would not be considered just office. It would be subject to your calendar year deductible, which starts in January. It's $350. For family, a total of $1,050. Then you start paying a 10% share of cost once you have met your $350 if you're using the PPO plan. And with that, you get to get the 10% credit towards what we call the annual out-of-pocket maximum, meaning that every bit of that 10% share that you incur will go towards the out-of-pocket, which means the part that Blue Cross pays, and it's a funny little amount of $333. So once we paid the $333, then it goes into 100% coverage. So it's a protection plan. It protects you so that you are not responsible forever and ever to be covering your expenses with a percentage. It does go into what we call an annual out-of-pocket amount. Notice that on the PPO, on the non-PPO plan, that means they're not providers of our network. They can really charge whatever they want, and that's fine if that's okay with you. We base the coverage payment upon a usual and customary fee, and it's typically done by procedure and by zip code and by doctor specialty. So with that, you would still be subject to deductible, and then we would pay the 30% of usual and customary. And then after that, anything that's over and above that would be your responsibility. So it could be a greater amount out of pocket when you do utilize the non-participating providers. So consideration, when we do have such a large network, wherever you possibly can, please stay within the network. When we talk about explanation of benefits in a little while, I will tell you that when you're using a non-participating provider, we are going to pay you and ask that you then negotiate with your doctor, your non-participating provider, as far as what you owe them. So that is a change that happened about 1.5 years ago, that we now, instead of paying the non-participating providers, we pay you. You're probably going to be the one to have to submit the claim. PPO, they submit the claim, and they also have a negotiated rate, which we'll talk about when we get to the explanation of benefits. Preventive care, I know I kind of went to that and everybody picked up their paper. So this sort of goes along with that piece that we were just talking about. When you use the PPO providers on the PPO plan, or when you use the HMO providers, there is a preventive services at 100%, which is really a plus. It incorporates the well baby check, the well child annual exam, well woman annual exam, and then well person annual exam. And then there are specific things that come into play at different age categories. And the piece that you were given is really a great piece because it does go into the age categories and what the doctors specifically believe should start happening at certain ages. So definitely when you are ready to do, your annual visit for your preventive exam, believe it or not, it's not preventative, it's preventive, if you notice how it's spelled. But most people call it preventative. It is preventive. And so what we're asking you to do is to tell your doctor you're coming for a preventive exam, and it is to be covered at 100%. This is new. This is brand new. This is healthcare reform, and this is a plus to you, a real plus. It keeps us on our toes to make sure that, why not, at the very beginning of the year, start out with a good exam, make sure everything is taken care of. I did point out at the last session that if you have a diagnosis, let's say I go in annually, but I've already been diagnosed with a thyroid condition, and I have blood work for that thyroid piece, that has got a diagnosis with it, so it's not considered preventive. So there could be a portion of your blood work that could be charged at the regular medical costs. So just wanted to let you know that as well. A couple of things about using your benefits wisely. The first one comes, ask questions when in doubt. I always recommend that before you go for a visit, whether it's just this preventive or whether it's to go in because you've had some symptoms and you really want to know what's going on, write some notes for yourself. Make sure that you're ready for that visit and you have your questions in hand, especially if you're under the HMO. What's the procedure? Oh, it looks like I need to go to a specialist. How long will it take before I can go? What's the procedure? Who's going to notify me? Ask questions. I think we do that so much for our children, but sometimes for ourselves, it's funny. We sit back and just let them kind of dictate, and we don't think of them until it's after the fact. So please prepare questions ahead of time. And if you get there and you're not getting it answered, I know sometimes they'll give me a laundry list of things. Okay, you need to take vitamin D, you need to do this and you need to do that. And they write it in such scribbles that I can't really read it. So I have a little notebook I take with me, just so that I keep track of exactly what my little visit entailed. We did talk about utilizing your preventive care benefit to stay healthy. We're going to talk about the generic as being a way of utilizing your drug plan. And we're also going to talk about urgent care centers versus emergency rooms so that we can save you some money and some time. So we're going on to the prescription part of the plan. It's actually a 3-tiered plan. And Anthem Blue Cross has what we call a formulary listing. And that means we have a listing of generic and brand prescriptions that we believe should pretty much cover any kind of medical need that you would have. Some doctors do not like or will not use some of the generic or brand prescriptions and want to offer you something that's not part of the formulary. Many plans exclude those and don't allow them to be covered at all. Your plan isn't set up that way at all. It's set up that we still allow those for non-formulary, but we ask that you share in the cost a little bit more, and you'll see that on the very next page. So lowest copayment is going to be your generic. Medium copayment is your brand, and then the non-formulary that's not part of our formulary listing is going to be your highest copayment. This is kind of tiny, I hope you can see it, but it tells you exactly what the cost is of your prescriptions when you go into the retail pharmacy and to the mail order. So when you go in just for a monthly supply of a generic prescription, you're going to pay $15. If you use the brand name and it's on our formulary, it's $25. And when it's non-formulary, it's $35. Now notice that next to that, you will see that there's a mail order piece. And that mail order piece is a program that we have that you send in a form along with a prescription for 90 days at a time. And if you're using generic, you pay just one generic copayment of $15. So you're actually getting 2 months of your prescription for free. If you're using the brand name, it's double the copayment, so you're still getting 1 month. And if it's non-formulary, you're getting 1 month for free. Now, this is something that's set up to be for maintenance type drugs. It's not for somebody that has an antibiotic that they need to start taking tomorrow, but it is really set up for something that's ongoing that you take routinely. Anybody in the room currently take the mail order? And you like it? It's working? It works really well. It's also a time saver. It comes to my house. I'm happy to have that. And I can call in for my refills when I'm ready, or I can go online and I can order my refills online. If you don't mind, we're going to wait for questions till the end. Also, just so you know, if you notice on the little piece that maybe you picked up, it's got a place to write notes. Make yourself a note because we're going to give a question and answer period. I'm happy to answer that, but I'd like to kind of keep going so that we keep the flow going. So definitely a good idea if those of you that maybe are considering using the mail order to talk to your doctor. If it's recently that you've been and they can give you an order for a year supply, that'd be great. They can usually send a prescription to you in the mail, and then you can fill out the form, and I'll show you exactly where to find it, and I believe it's probably also on your website here as well. So a good program, gives you some benefits, certainly less expensive than if you had to pay the full cost. There is another program that's called our Specialty Network. It won't affect as many of you in the room, but there is a program where we have a specialty drug part of our company that fills orders for specific, very severe illnesses. And they work directly with the doctors and with you to make sure that they get those prescriptions to you. So if you've been recently diagnosed and you have something that's pretty severe, it might be worth your while to call the customer service number and find out if there's any particular procedure that you need to follow, because they will help to get you facilitated and set up so that it comes through the mail as well. HMO versus PPO, we talked a little bit about that, but I think this is a great little piece. Here's some of the reasons that you would want to have the PPO. It would be want more control over your health care and access to any doctor or specialist. That's the PPO plan, whether it's PPO providers or non-PPO. You have the right or the choice to go to either one. Are you willing to pay out-of-pocket deductible coinsurance for your health care services as they occur? When we talked about the HMO, notice that it was all co-payments. It wasn't any percentage of out-of-pocket or any deductible. With the PPO, there is a share of cost, a bit more responsibility on your part to share in the cost of the plan, but it gives you that flexibility. Under the HMO, are you willing to select a specific medical group and physician to coordinate all of your healthcare needs if that's something that you're already having? Maybe you're in a PPO now and you find out that your primary doctor that you go to under the PPO is also part of the HMO. You might want to talk to them about the availability of using the HMO at open enrollment. Something to consider. You know, how would that work? How could I use that of value? Do you want to pay as little as possible for your health care service as they occur? I was talking to a gentleman in between the sessions, and he has a family of 5, and they've all, believe it or not, been diagnosed with asthma. And he said it's really ending up costing him a great deal of money because they're going to the doctor a lot more, they're having prescriptions a lot more, they're using the plan a lot more, and he has the PPO, and I recommended that he might consider how that could work if they were to change to the HMO at open enrollment. Would that be a consideration to save costs? This would be one of the ways to consider that. Under the HMO, there's a couple things I call them my handy-dandy hints. I just think it makes life a lot easier. Know that it's really your primary care physician that directs your care. We talked about that. They're the ones that send you the specialist. The medical group has a listing of contracted providers that they are responsible to send you to. And then with the referrals, ask what the time frames are. Many times we think, oh gosh, we got a referral, I must have to get in there tomorrow, So it's always important to find out, is this something the doctor is concerned that you get into right away? Or what is the time frames? Again, remind the doctor that you'd like to know exactly how that works. What about changing doctors? Can I do that throughout the year? Yes, you can. You call customer service. We'd like you to call by the 15th of the month. The reason for that is we need to get a new ID card out to you, and we also need to notify your new primary care physician. So it's important for us to know ahead of time and get that prepared so that we make you effective the first of that next following month. The only time we are not able to move you to a new medical group is if you're in the middle of care. The new medical group won't take you until you're finished with that treatment plan. So just know that that will be the first question that's asked when you call. Any other time you're not happy with your doctor, now you've been here to this session and you think, I really am not happy. I think I am going to change. Easy to do. Just call customer service. That number's on your ID card, and it will take you right to the customer service folks, and they will help to get you changed to the new primary care physician. What happens if you get a bill at home? It's not happening as often as it used to, but it used to be that folks that were on the HMO said, okay, I'm not supposed to pay anything but those co-payments, so I'm not responsible for any of the charges. But guess what? I went last month to my family's house, and I was transported by ambulance to the emergency room. And now all these bills are coming to me. Please do not ignore those bills. Make sure they get back to the medical group, because that's who's supposed to be paying for them. And many times we think, oh, well, they're just billing me too. Please don't ignore those, only because they maybe don't have the address for your medical group. They didn't get to be in as part of that team that pulled your card and saw where to send claims. So don't ignore a bill if you're on the HMO. Make sure that you get it to your medical group. If you have any questions, please feel free to call customer service. We're there for you to order new ID cards, to help you change the different primary care physicians. If you're on the PPO, we're there to answer questions about claims. If it's HMO and you've got some services that you don't know what to do about, that you're getting a bill for, call us. We'll help direct that for you. PPO, I think the most important thing we talked about is you notice the difference between the PPO providers and the non-PPO providers. And please notice that, again, that when you're going to the out-of-network providers, that there could be a greater cost to you. If you're going to have a procedure, make sure that your doctor knows, is there any kind of authorization required for you to go into the hospital or into the outpatient surgery? Or if you're having an MRI, is there anything that the doctor needs to do? Make sure that they are following the guidelines of the plan. Ask them to call your plan and make sure that they've got everything set up correctly. Many times we do have specific requirements that the doctor has to help us with. So we appreciate it if you would talk to your doctors. They get millions of people in every day. No, not every single person has Anthem Blue Cross. So for them, you're just another patient. So in order to get the best level of coverage, you want to remind them that you do have the Anthem Blue Cross plan and that you want to make sure that everything is authorized and that everything is taken care of. We talked about the out-of-network and the fact that you would be getting the explanation of benefits with the check for those providers that are the out-of-network. If you need to file a claim, there is a claim form online that you can use. That would only be in the case of a non-participating provider. All our PAR providers will submit the claims for you and typically wait to be reimbursed for anything until the bills have come into Blue Cross, Anthem Blue Cross, and then the explanation of benefits is produced, and they'll send a bill to you. This is a sample of what an explanation of benefits looks like. It doesn't typically affect the HMO folks, but for those of you that have the PPO, it was interesting. I was sitting in the lobby and I had a couple of people come and talk to me, and one of the ladies actually brought her explanation of benefits with her. And she said, how come I'm responsible for $129? And I said, well, see that little one behind it? It says it applies towards your deductible. So good idea to look at the bill, at the explanation of benefits carefully. Make sure to look at what the cost was that was originally sent in. If there was a discounted amount, which is typical with our PPO providers, there's going to be a discount that applies, and then you're going to be subject to the deductible or the percentage of out-of-pocket based upon those discounts. If it's an office visit copayment, then it will say $20 office visit copayment, and it will show amount. You'll never get to see the money, though. It always goes to the provider on the PPO side. So important to look those over. At the top, it says you should pay this, and it will tell you exactly what to pay. If you ever have questions about an explanation of benefits, the claims folks can walk you through the whole process as well. This just goes into some of the same things. We talked a little bit about the cost for emergency rooms. They are $100 unless you're confined to the hospital. But one of my recommendations is that we have a great network of urgent care facilities that are available to you under the HMO and the PPO. And I wanted to make you aware of them because if we're looking at saving costs and what's convenient, most of the time I would say that the urgent care is going to be the better place to go. Certainly if we look at emergency rooms, we're looking at life, limb threatening, unconscious, bleeding, poisoning, overdose, stroke, heart attack, something either you'd be taken by an ambulance or you would be rushed to the nearest hospital. We want you to go there because that's where you need to be. But if it's something other than that, let's say it's ear infection with a high fever, or it's vomiting, or it's minor burns or strains, or something that you just had a cough that's gone on for a month or so, that typically is a good place to start with the urgent care. And the reason for that, it's just a $20 office visit copayment. There's no extra charges to that. Under the HMO, it's really up to your medical group where you go. So those of you that are on the HMO, I recommend you call your primary care physician and say, I just heard about urgent care. I want to make sure I know exactly where I'm supposed to go. What are the rules? And then find out what the hours are. I know exactly when mine's open. I know when they close. I know when it's the slowest time of the day. So I go there and try not to hit the biggest crowd. So important to check with the medical group if you're on the HMO. If you're on the PPO, we actually have a listing under our provider site where you can look up urgent care facilities by address, and then it will tell you the location, and then from there typically we'll have the times as well. So take advantage of that. It gives you upfront $20 office visit copayment, and then if there's any extra procedures, they would help with that as well. So we've talked about emergency versus urgent. I think we've pretty much covered that. A couple of things that I want to point out is that we have a fabulous website, and I'll show you that in just a minute. And with that, there's all sorts of special offers. I think each one of us will talk about some of our discount programs. There's, as you can see, baby maternity magazine, there's Weight Watchers, there's Lindora, there's Jenny Craig, gym membership in Global Fit. Vision and hearing, I know you've got a great VSP plan, but if you had, let's say, a second pair of glasses that you'd like to get for reading, it's not covered under VSP, a great way to get a discount for that by showing your card. And then all types of alternative therapy and different management kind of things that would be available to you. The best way to find them is on our website. And I'm going to just skip to that because I want you to see it. This is the front page of our website. And if you scroll over to the right-hand side, my computer only takes in just the part where it stops at the purple. So I didn't know that there was more, and I thought, oh, wow, what are we going to do here? As you notice, you can scroll over further, and at the very top is a customer care piece. You can actually go in and get some of the forms that I was talking about there. But also, underneath that, you'll see that there's a member login ID where you can sign up as a member. And with that, if you wanted to, you could take the guided tour first, and that will show you all the benefits that are available to you under the plan. If you're on the PPO, you can look at your explanation of benefits. If you're taking particular prescriptions, it's going to show you all your prescriptions. So it's kind of like banking online. You don't have to keep that paperwork handy. You can look it up. Besides that, we have a whole bunch of what we call our health programs, our 360-degree health programs. If you wanted to start walking program, you wanted to look at some of the weight loss programs that we have, we've got great recipes. We're encouraging people to take health assessments that are available online so you can see where you stand. And then there's also WebMD that gives you information about all sorts of different conditions that might occur with you. So it just has a whole load of information that I think would be very, very beneficial to you if you became a member. You will get your own password. No one else will be able to see this information. So if you have a spouse that's on the plan, they'll have to sign up as their own member. If you have children that are over age 18, then they have to sign up themselves. If you have children on the plan, you can view their information as well. But otherwise, it's adult has to sign up as an adult. Albrecht? If you're not used to PPOs, it's probably a little different than what you've experienced if you've been on a HMO where it's just a copayment.
So first is the deductible where they don't cover anything. You have to pay the first $350 upfront.
I think I misled you. I got a little bit better clarification when I got to see my summary. And Joan just confirmed it. Number one, the $20 office visit is upfront. You use that from the beginning if it's just for an office visit. If it's preventive, it's 100%, so you pay nothing. Any other medical types of visits or any procedures or whatever would be subject to the $350. Then you start paying 10%. Those 10% adds up to $333. Once you've met that, then it goes into 100%. Does that make sense?
Yes, thank you.
Okay, good.
Kathy, we have a question over here. I have two questions. The first, does the doctor determine the preventive care?
Yes, the doctor typically would. You could take that with you. I don't think it's a bad idea to take it with you, take the paperwork with you, because this is a healthcare reform guidelines. It's not Anthem's guidelines. It's all insurance carriers' guidelines. I think the doctors are struggling a little bit with it. In fact, I took my preventive care because, of course, here I am, Anthem Blue Cross, and said, here's my guidelines. And the doctor was very confused because they're still learning about it too. So I said, follow these. So I don't think it's a bad idea to just take that with you and say, here's my preventive care. It's healthcare reform. It's across the board, the same for any insurance carrier, not just Anthem Blue Cross.
Okay,
Good
thank you.
question.
And my second question was, if you disagree with the actual billing items, who do you turn to?
Your doctor, because they're the ones that are billing Anthem Blue Cross. So, for instance, in my case, they took lab work, and part of it was that for the thyroid, the blood work for the thyroid, and the other was just regular blood work for my annual physical. So the thyroid went towards the deductible, but the other was at 100%. Because it had a diagnosis to it. So there's a difference between something you're looking at to take care of and prevent and something you already have. Any other questions? Yes, sir.
Carol.
Hi, my question is kind of the same as Pablo's, but for the HMO. One of the things you said in this presentation is that if you really shouldn't be getting bills at the house. I have a family of 5, and we are in the HMO, and I do get bills at the house, and they're all for varying amounts, and you say there's a lot of activity in a month, maybe at the beginning. How do I know when I've met my deductible amount or not? Is somebody keeping track of that? I feel like if I mail a check off to the
Okay, number one,
I'll never get it back if I've overpaid.
Okay, he's worried about deductible with an HMO. There is no deductible with an HMO. That's the first thing. What I meant by protecting yourself with the bills is typically if you didn't get a referral from your medical group and you went outside because there was some reason you were sick and you were away from home, then the bill came to you instead of it going to the medical group. The medical group is responsible to pay for everything. You are responsible to pay for the co-payments.
So if
you get a bill, then you need to call them back and say, I was referred to you by my primary care physician, please deal with the medical group.
So I got a number of bills from my primary care physician, and I'm in the HMO, so
Then you need to call them back and ask why they're billing you.
am I getting a bill?
Uh-huh, that definitely, except for paying your $20 co-payments, that's what you should be paying.
So
And if you-
actually,
if-
you do kind of ignore them, but you also just give them
Yeah,
back.
don't ignore
pay
them. I'd rather that we settle it. If you have difficulty and they're not helping you, call customer service. Yeah. Okay, we got to get moving because we got other speakers, but I'm happy. I know you asked the question at the very beginning. This is my first question. Right here, Debbie.
The $500 out-of-pocket for
Okay,
HMO.
so what would happen is, that's not a deductible. What you're asking is, what is this out-of-pocket under the HMOs? What that is if you had $20 office visits that accumulated to $500, then there's no more co-payments. It would be pretty hard when you figured out mathematically how many times you'd have to go to the doctor to reach $500. So you would have to keep track of your receipts, and if you reach $500 of co-payments, then you let your primary care physician know, and it should be 100% for the rest of the year.
A pharmacy and stuff, is
No,
it?
it
So
only
it's-
is medical. It's just your co-payments. Just your co-payments.
Nope.
Emergency room does not count towards the copay. It's only the $20 co-payments. And it typically is, again, it's a protection for people that are really sick. Good question. Yes, one more, and then I'll have to take the rest of them off the side.
What if you go to a dermatologist to get a full body scan for skin cancer, whatever? Is that preventative or not?
I would say that isn't necessarily considered preventive. The question was a full body scan. Full body scans, whether they're dermatology or whatever they're for, is an iffy thing. Lots of times they include a lot of other procedures. It
Looking at
depends.
your skin to see.
Yeah, I wouldn't be able to answer that question. It would have to be submitted. I don't think that it's listed on the preventive care as being something that's covered as, a body scan isn't typically covered under preventive. Good question, though. These are questions we need to know about. I'll be there afterwards. I want to let somebody else get on and talk.
Thank you, Kathy. Next, we have Joy from MHN, your behavioral health and EAP coverage. Kathy will be here till 2 o'clock today if there's any questions after the meeting.
Hello, everybody. I'm Joy Baloma from MHN, and we do, as Anne Marie just said, your behavioral health and your EAP benefits. Behavioral health covers mental health and substance use disorders. The EAP is a clinical program where you can go see counselors, and we also have several other services. Okay, so that's what we cover you for. Behavioral health diagnoses will include things like cognitive disorders, dementia, including treatment for Alzheimer's, eating disorders. That could be bulimia, that could be anorexia, it could be whatever is a diagnosable illness. Schizophrenia, bipolar, those are all covered under the behavioral health program. Treatment methods that you'll find are could be acute hospitalization, could be residential care centers, could be inpatient or outpatient, intensive outpatient therapies. What you'll find with the behavioral health is that MHN is nationwide. We have treatment centers and program and facilities across the country. So anywhere you are within the U.S., you can get treatment. Your dependents can get treatment if an occurrence happens. Okay? If you're out of the United States, you can get emergency care treatment, and then you'll be expected to return home for any more in-depth treatment. The EAP. The EAP benefit gives you clinical help and assistance for a variety of psychological and addictive issues or family-related issues. What you get is 3 sessions with a clinician, and it's 3 sessions per incident per year. So let's say at some point you're having some anxiety issues. You can call the 800 number and you can get an authorization to get 3 sessions with a therapist for that issue. A couple of months down the road, let's say you're having some marital issues and you want to talk to somebody at that point. You can go, call, get authorization for 3 visits for that problem. This benefit and the behavioral health covers you and your dependents, spouses and children, as well as retirees for the program. All benefits are confidential. You have an 800 number where we are answering those phones 24/7, 365 days a year. Okay, you talk to an intake rep, they will assess you. When you call in, you will be asked if you're if you're in a crisis situation, as some people are. If you answer yes to that, they will immediately warm transfer you to a clinician within MHN who will help you with that issue and stabilize you, and then recommend whatever course of treatment you need to have, okay? The behavioral health, you use the same 800 number if you need to go seek services on that level of care. There are 3 ways that you can get your EAP benefits and services. One is traditional face-to-face, where you call us, we give you the authorization, you are then provided with the names of 3 therapists within your area. You then decide and determine which of those therapists would best fit your needs, either by location or whatever criteria you want to use. You call that person and you get an appointment. That can take 3 to 5 days by the time between you working out your schedule and their appointment schedule. The other two ways you can access service for the EAP is telephonic and web video. And telephonic and web video services we use MHN clinicians who work for MHN out of our Tempe, Arizona office. They are available every day of the week, during the week until 9 o'clock Pacific time. On the weekends, it's till 3 o'clock Pacific time. You will always, once you start using a telephonic or web video, you will always get the same counselor. Okay? The beauty of telephonic and web video is that they're not limited to 3 sessions. It's until resolution of the issue, so if it takes longer, you can have longer. The web video, you need to have Skype available, and then our therapists use Skype on their computers. So you can access care from home. If you're traveling, you can access it from a hotel room. You can access it from here at work if you have time that you can do that. You get the same amount of time to talk to the therapist as you would with a face-to-face. It doesn't take away your face-to-face visits, so you still have 3 of those available to you. And you and the therapist are talking back and forth on Skype. So you see the therapist, they see you. It's just like being in a face-to-face situation, but you're on your computer. Okay? The other part of the EAP is what we call work-life services. And this provides you with help in a variety of areas that are those little stressors that come up during everyday life. And this is to try and keep things better balanced for you. You can have child care and elder care services. Those are referrals. And what you do is, let's say you've had your first baby and now you need to find child care in your area. You call the 800 number, you give them a zip code, they will call you back within 3 days or email you with a list of child care facilities in that area. Then you have to vet them and determine where you're going to go. Same thing for elder care. And elder care, again, across the country, if you have parents or in-laws that are living on the East Coast, you call, you give the intake person that zip code that they live in, and they will come back with assisted living facilities, adult daycare programs, community service programs that are available in that specific zip code for you. We also offer legal, financial, and identity theft services. The legal and financial services, you get a 30-minute free consultation. For the legal, it's with an attorney or a mediator. For the financial, it's with a financial advisor. On the legal, you can also get a 25% discount off of their hourly fee if you need to see that attorney for an ongoing issue, which is a pretty substantial savings if you have a detailed program. On the legal, you can do it can help you with just about any legal issue, except if you want to sue your employer, they won't let you do that. So anything else, have at it. The financial is the 30 minutes. Identity theft gives you a 60-minute consultation, and they will help you. If you've had your identity stolen, they will help you put out fraud alerts. And they'll help you file with the police department and give you guidance in that. So they really do a lot of work to help you get over that hump. Another thing we do is daily living services. And those are the kind of things that, what do I do? How do I find something? You move to a new area, you need to find out where the veterinary offices are. Call the 800 number, give them the zip code. Again, they'll send you all of that information. Auto repair places. If you need a home maintenance, they can do that. They can, if you're traveling across the country, let's say you're going to do a driving trip across the country on your summer vacation, and you're going to have your dog with you, and you need hotels or motels that are pet-friendly, you give them your route, and they'll send you back hotels and motels in that area that are pet-friendly. They will help you plan a party, and they'll help you get names of wedding planners in specific areas. So that's all available to you. All these services, behavioral health, EAP, work-life services, you call the same 800 number to access those services and benefits. Another thing that we provide is a website. If you haven't been on it, I really encourage you to get on the website and cruise around it. You'll find a lot of information. There are two ways to access the website. When you go into members.mhn.com, it will ask you to either use an access code, which is LBCCD, or it will ask you to register. If you want to register, you give them your email address and you create a password, and then you use that in the future to get in and out. There are some things on the website that you cannot access unless you've actually registered, and we'll go over that a little bit. But just using your access code, you go in, you can find on the legal and financial services, you can find a lot of information on different legal information that will give you, say, a simple will is on there. A lot of legal documents. You can download them. The simple will, you can fill it out. You have it notarized. It's as legally binding as going to an attorney. There are several other legal forms that you can find on that. On the financial part, there's articles about different financial information and how to set up programs. There's a calculator if you want to put in how you're saving money, what your investments are. It can help you. It will help determine if you are on the right course and if your investments are going to help you, say, get to a retirement, to those golden years with some money left. That's all available on the website. The other thing we have on the website is health and wellness resources. And there's a health and wellness tab, so you click on that. Again, a lot of articles. It can help you do meal plannings if you want to change your eating habits. It can help you start a exercise program. It can give you pointers on just about everything that you need to keep yourself healthy. There's another piece of that on that wellness, which is called a well-being assessment. That is locked. It's one of the things that you need to register in order to access. And it's a health referral. So it's a health risk assessment. So you go in, you fill out the questions. It takes about 20 minutes. And then they'll email back the results. And it will tell you if you're healthy, if you need some help in certain areas, or if you're really at the bad end and really need to get a lot of help. And it will give you some guidance on what you can do to help yourself and get yourself back into the healthy mode. We also have a self-help section, and that section has assessments on it. The assessments are locked, so you need to register. And they can tell you if you're feeling depressed and you're not sure, you just think you might be going into a depressive mood, go on, take that assessment. It will give you feedback as to whether you're depressed or not, and it could help guide you on the right type of service to access. It also has some things that you can do and a couple of other assessments. One is an anger management assessment. So if you have an anger issue or you think you have an anger issue, you can go and it can let you know, yes, you do, no, you don't. Maybe you're tending toward that based on some of your answers. And then we have an e-learning, and the e-learning has about 6 videos on it, and that will allow you to go home and watch these videos for 15 minutes. They're workshops for you to access, okay? The 800 number is 800-777-9355. We are 24/7, 365 days. There's also some brochures that the HR department has that have a wallet card in them, a wallet card that you can tear out and carry around with you. Any questions? Yes.
Do you do any preliminary screening for the child care providers referrals?
Do we do any screening for the child care?
Like any preliminary screening?
No, we don't. We don't vet at all. It's really a referral service. Anything else? Okay, thank you.
Thank you, Joy. Really quickly before we invite Delta Dental up here, I just wanted to let you know that the back table, when you walked in and you picked up a few items, there's a Anthem Blue Cross list of preventative health guidelines for men, for women, and for children. So this is great to use to keep with you when you see a doctor for any preventative services. Also, there is a sheet that says prescription drugs. This is something that we at Burnham Benefits put together for you. It's actually a $4 generic program that Walmart and Target both have. This list is subject to change, so if you frequently go to Target or Walmart, you can always check their up-to-date list of generic drugs that are covered for $4. So rather than going and paying your $15 for your generic, if it's on the list at Target or at Walmart, you can pay $4 for it. Okay? And next we have Peggy Nieto from Delta Dental.
Good morning. Okay, I'm going to briefly walk you through your two Delta Dental options. The college offers you both a PPO and an HMO plan. The Delta PPO plan essentially gives you access to any licensed provider of your choosing. Here in California, there are almost 18,000 PPO dentists licensed with Delta Dental. You will have substantially more savings with a Delta PPO provider. On the screen in front of you, you see, just as an example, typical silver filling paid at 80%, and the dentist bills the same amount whether he's a PPO Premier or a non-Delta dentist, and then it shows you the contracted discounts and what the member co-pays are. So if you look at the bottom column or bottom line, patient saves, you'll see that on a PPO plan for this particular procedure, you'll save approximately $64. On using a Premier provider, you'll only save $40, and you would have no savings with a non-Delta dentist because they have no contract with this. They're under no obligation to discount their fee. And I apologize if I'm moving too quickly, but I will have my table available through the rest of the day until 2 o'clock, and I'll be free to answer questions. So on a PPO, you have flexibility. You choose the network or the provider of your choice. Your cost savings are approximately 20 to 35% when you're using a PPO provider. And there is no balance billing from any Delta contracted provider, whether they fall under our PPO or Premier network. This is the plan you have here at the college. Your deductible is $25 per person, $75 per family. Annual maximum, if you're with a PPO dentist, is $2,200. If you're with a non-PPO, whether it's Premier or a non-Delta contracted dentist, it's $2,000. Diagnostic and preventative care is 70 to 100%, as is basic benefits, crowns, and cast restorations. The incentive plan starts out paying at 70%. The first year you're covered under the plan as long as you go to the provider once that calendar year. Then our claims will be paid at 80% the next year, and 90% the following year, and 100% the next. The plan here at the college provides 3 cleanings per calendar year, and some of you are under the assumption that you have to have all 3 cleanings in order to advance to the next level. And actually, you don't technically even have to have a cleaning. As long as we have a dental claim hit our system during the previous calendar year, then the following January you will bump 10%. Once you reach 100, you stay there unless you have a break in coverage. You have a dental accident benefit of a separate $1,000 maximum per person per calendar year. So if you or anybody in your family has an accidental injury related to sports or any other type of injury that involves a tooth, have the provider check the accident box on the claim form when they submit their billing to Delta so that it's paid under this separate $1,000. So you're going to save the most money with your when you're with a Delta PPO provider, and you have no savings with when you're with a non-Delta participating provider. In the middle is our Delta Premier providers, where you'll achieve a smaller percentage of savings. Our 2 national networks are available for you no matter where you travel in the U.S. Coverage outside the U.S., again, you would have to pay for those services. I think like Anthem discussed, pay for it on a credit card. Make sure you have the bill translated if you're in a country that doesn't speak English so that we can process that claim when you get back. If you go to an out-of-network dentist, you absolutely have the freedom to do so. Your reimbursement level will be the maximum plan allowance. They do not agree to Delta Dental's contracted fees, and they can balance bill you. They may charge you to fill out a claim form. Claim forms are available on our website. Just click on the claim form link on the right-hand side and download the form. Pre-treatment estimates are highly recommended whenever the work is going to be over $300. Your provider submits his treatment plan to Delta. Delta reviews that based on your plan and benefits here at the college. They verify whether your deductible has been met or whether you've reached your annual maximum, and we send a report back to both you and the provider explaining each procedure by code and description, what the copay is that you're responsible for and what portion Delta is going to pay. So you know before you begin any extensive work exactly what's going to be covered. Here's what your notice of payment statements look like when they come in the mail. Every time we pay a claim, no matter what type of provider you see, you will receive one of these. So if you're not receiving them, double check your address with Delta. If you've moved and not updated it, they might be going to your old address. You can register to receive these by email, and Delta will store them online. So if you choose to go green with your statements, registering for that program is available online on our website, deltadentalins.com. We will send you an email whenever we pay a claim, and at that time you can open the email link, make sure your claim was paid correctly. If you agree it's paid correctly, just close the link. If you want to print it out, you can. If you don't want to print it out, we will maintain 7 years on our website at all times. That way, when you need them for tax purposes or your 125 account reimbursement at the end of the year, you can just go to the website and download them all at once. The HMO plan is your other option to the PPO plan here at Long Beach College. It is a prepaid plan. It provides you with diagnostic and preventative care at set or no copays. Your costs are very predictable. You pre-select a provider when you enroll. You must notify Delta Care USA when you want to change providers. You can do that every month if you so choose, and you can change providers by calling us up on the phone or by going to our website. There are no annual maximums or deductibles, no claim forms for you to fill out, and this plan does cover orthodontia. So if you're looking for a plan with orthodontia care, this is the one that provides the coverage. It's easy for you to enroll, easy for you to receive care. Just go to the provider, pay your copay. The dentist handles everything else. Here's the highlights for the orthodontic plan. It does cover limited, interceptive, and comprehensive. Often the orthodontic provider will call those phase 1 and phase 2. So if you have a young child around 8 or 9 that the provider is recommending orthodontic care for, you may have found out if you're contacting Delta that we do cover it. There are set copays for that. We do have a takeover provision, so if you're new to the college and someone is currently in orthodontic care, this would be if you're enrolling on the HMO only. We would provide a takeover of your plan, of your treatment going forward, and provide you with the same benefits you had before and allow you to continue seeing the same orthodontist whether or not they contract with Delta Care USA. You have out-of-area emergency care allowance of $100 per person. Your specialty care will be coordinated by the primary care dentist. It's easy to switch. Delta Care USA dentists, just call us up, call our 800 number, or go online. Family members can choose their own provider, and there are minimal limitations and exclusions on the HMO plan. And I do have highlight summaries on my table if you'd like to come by after the presentation. This is what our website looks like. If you go to our website, you can take a look at our dentist directory. That's that little guy in the white coat on the lower right-hand side. You can take advantage of our Enrollee online services, which include providing you with your benefit and eligibility information, claim status, fee finder, where you can find out what the average cost is of a particular dental treatment in your area, and a printable ID card if you happen to have lost yours over the years. This is what our website looks like for the directory, provider directory when you look up a particular provider. If you need help from customer service, just click on the customer service link on our website. It will bring up this little screen that you see in front of you. Complete the screen, put your question in the box, and we will answer it for you. Thank you for your attention. Are there any questions? Thanks.
Thank you, Peggy. We have Renee Salvador from VSP.
Okay, everyone, you're in the home stretch. I'm going to keep it short and simple for you. Most of you have already used VSP, most likely, so this is not going to be new for you. Just a quick history on VSP. We are the oldest and the largest vision company in the country. We cover about 1 in 6 Americans. So the good thing about that for you is that you have a really simple plan to use. Most of doctors see many, many VSP patients on a weekly basis, so they know exactly how to use the plan, and it's going to be simple for you. We have a large private practice doctor network, and we have a member promise so that we are guaranteed to do whatever it takes to make you happy. So within that large network of doctors, they know the way that VSP works, and they are going to do whatever it takes to make sure that your glasses are correct, your contact lens are fitting properly, and that you've had an overall great experience. Because our doctors do own their own practices for the most part and have been in business for many, many years, they truly get to know the history of you, your health, the health of your eyes, and it makes it great for them to have that so that they can continue to provide the best care possible. Most of them have weekend and evening appointments and are very close to either home or office, so it should be simple for you to find a VSP doctor, and they always welcome new patients. So this is a snapshot of what your specific benefit is. You can see side by side in-network and out-of-network so that you have kind of a perspective on things. About 98% of our members across the country do stay within the network. So it's similar to your medical or your dental plan, where you're always going to get the best benefit if you stay in the network. So I'll cover that side of it, and on the right you'll just see the amounts that you would be reimbursed if you did step out of the network. You have a $10 copayment either way, and your exam is going to be covered for you 100% every plan year. Your lenses are also going to be covered for you 100% every year, and that's single vision, lined bifocals, or lined trifocals in glass or plastic. If you get anything beyond that, tints or coatings or any type of specialty lens, you do pay extra for that. However, you are given a discount because we do make sure that our doctors are offering you cost controls, not discounts, because discounts just mean that it's a percentage taken from whatever the price is that they want to charge you. But these are actual cost controls, so we let them know how much they're allowed to charge you on each extra thing. As far as frames, that frequency is a brand new frame every other year, and you have $120 to spend on the frame of your choice. You're not limited to any particular collection or tower. You can take that $120 and apply it to any frame that you like. If the frame is more expensive than the $120, then you are given a 20% discount of the difference. Contact lenses are in lieu of frames and lenses, so for those of you who do wear contact lenses, you can take that $120 benefit and put it toward the purchase of contact lenses. The exam is comprehensive. During the course of the exam, the doctor is not only checking your refraction to be able to determine a prescription, but the doctor is also looking for other problems and signs of health conditions. You can see the top conditions listed here that we hear about all of the time on the news. In many cases, a VSP doctor is actually the first to detect signs like this that would lead him to send you back to your primary care physician and work back on these types of conditions. So it's important, whether or not you wear glasses or contacts, certainly for all members of your family, make sure that they have an annual eye exam, because these things are only detected that way, since we know that only 1 in 10 Americans that have a health plan actually have a full annual health appointment. They actually, 6 in 10 will go in and see their eye doctor. So we really want to encourage that. These are some additional savings with VSP doctors. So you can see that on those extra things we talked about that aren't covered, like tints and coatings, you save an average of about 35 to 40% on those different options. If you decide to get extra pairs of glasses on the same day, then you get a 30% discount on as many additional pairs of glasses as you like. If you decide to get them within a year's time, then you get 20% on any additional pairs of glasses. These are additional savings, so 15% off of the cost of your contact lens exam. For those of you who wear contacts, you know that there's an additional portion of examining that the doctor has to do to be able to determine the proper fit of your contact lenses and prescribe those for you. So it's important that you know that those services are going to be extra, but because you have VSP, the doctor's required to take 15% off of those totals for you as well. If anyone's interested in LASIK, we do contract with certain centers that are listed on our website. You can certainly learn more about that by going onto our website, but we have an about 15% average discount for you that's negotiated in the price of LASIK for you. And of course, after LASIK, you can use your frame allowance, which in this case is $120 on non-prescription sunglasses at any of our VSP doctor's offices. So for any of you who've already had it, make sure to take advantage of that benefit as well. Of course, using your benefit is really simple. All you do is find a doctor, and you can do that either by going to VSP.com, calling our toll-free customer service number, or I do have paper doctor lists at the table here today. Once you find a doctor, call to make your appointment, simply identify yourself as a VSP member, and then you come in for your appointment. That's it. The doctor's going to work with us behind the scenes to make sure that your authorization is handled for you. There are no claim forms, and there's no ID card for you to have to wait for. We do offer an extremely large private practice network. We kind of went over that before. Our doctors are credentialed to the highest possible standards. And in addition, now you are able to use your out-of-network basis at a Walmart, a LensCrafters, or a Sam's Club. Not in-network. The amounts are still the out-of-network allowances. So you have to remember that when you're considering where to use your benefit. However, the reason that it's important to you is because now it's an easier process. If you go to any of those retail chains, instead of you having to pay up front, submit receipts, and wait for reimbursement, those places now have an arrangement with us where they will actually call us to find out what your benefit is and then wait for payment directly from us. Okay? Member Services Department, usually when you call, the average hold time is always under 20 seconds, so it's a really simple call to make, and we get a lot of really great feedback on our website as well. So if you need more details as far as help finding a doctor or looking at your benefits specifically, please feel free to either log on or call our toll-free customer service department. That's all I have now. Does anyone have questions?
Is there any questions?
If you're just using the allowance for the sunglasses after LASIK, do you get the 20% additional discount as well?
On the frame?
Yeah, if it's non-prescription?
Correct. You would get, just like the regular frame benefit, so you'd have $120 on the frame and then 20% discounted on any difference. Thank you. Okay, thank you very much.
Thank you, Renee. This concludes the session of the benefit workshop.